Let's talk about Loxoceles reclusa, also known as the brown recluse spider. In North America, the brown recluse is one of 3 spiders that can create a bad reaction in humans. This is a black widow spider, which is more endemic to where I live in Southern California. We see these every now and then. I stay away because they cause a lot of edema or swelling wherever it bites, and it's really painful. But it doesn't cause necrotic tissue like the brown recluse does. I lived in the Midwest before, and I've seen one of these, and I've seen bites from this type of spider. It has a very typical identifying feature. It has this fiddleback with this violin shape on the top of its body, the dorsal surface. And this is the scariest spider to get a bite from because you get this type of rash, this necrotic tissue. That center part is going to turn black and this tissue dies. It is a very aggressive looking, scary looking residual that you get on your skin from a bite from one of these brown recluse spiders. It is a big deal. Here's somebody who had his finger bitten. As you can see, it turns black. That area will definitely scar and create some long-term effects. This is not the same thing. This is a bullseye rash. This is likely an early sign of Lyme disease when you were bit by a tick that transmits Lyme disease. People often blame spiders for a lesion that they have on their body or their skin that certainly can be very painful and can be very concerning. Most of the time, it is not due to a spider. I'm not saying that they're never due to a spider. They can be. A brown recluse, though, will really create this necrotic, ugly reaction, black skin. It is a scary sort of phenomenon. And there's no test, no skin biopsy to isolate any venom to prove that it is a brown recluse spider bite. It really is diagnosed by the reaction you get on the skin, what it looks like afterwards, if there's black necrotic tissue, if it's a big, large area of your skin, and you were in an area that brown recluse live. Yes, this is high in our differential diagnosis. If I see this on somebody in the Midwest, one of the first things I'm going to ask is, do you think you were bit by a spider? Have you been around any big pile of wood or debris? Because that's usually where these kinds of spiders like to hide. And if I don't see a reaction like this, I cannot, with more certainty, say that somebody was truly bitten by a brown recluse spider.